Hello student, myself Dr. Swati Tayale, working in Sandeep Institute of Pharmaceutical Science, delivering a talk on large volume parenterals. So let's discuss here what will be the learning objective. So learning objective, first get familiarized the concept of parenteral with characteristics of large volume parenterals, to understand types of LVP with specialized LVPs, and then discuss the concept of intravenous and non-intravenous LVP. So let us discuss here what do you mean by parenterals. So parenteral derived from two Greek words, means the para, which indicate besides, and enteron, which indicates as intestine. So parenteral dosage form administered directly into the body tissue rather than through the intestine with the help of an injection, we can consider as a parenteral. So active substance or the formulations are administered using gravity or force directly into the blood vessel, organ or the tissues. So these parenterals initially classified into the two types, that is small volume parenterals and the large volume parenteral. So here we will see in brief what do you mean by small volume parenteral. So as per the USP, the SVP, it is nothing but an injection that is packaged in container which labeled as either 100 ml or the less, and for example calcium gluconate injection or the ascorbic acid injection. Whereas the large volume parenterals, as per the USP, it is nothing but the single dose injection, and it is intended for the intravenous use, and it will be packaged in a container labeled as containing more than 100 ml. Now the next we will see the characteristics of the large volume parenterals. So first characteristics for the SVP as well as the LVP, it should be sterile, non-pyrogenic and free from particulate matter. Now when we consider the LVP, the volume with the single unit, it should be more than 100 ml, and the LVP many times does not contain any preservative, and the volume it should not exceed the 1000 ml in intravenous LVP. Whereas when we consider the non-intravenous LVP, the volume exceeded the 1000 ml, and for example irrigation and the dialysis solution we can consider. So peritoneal dialysis solution, this is the very best example. Then it should be isotonic to minimize the damage which occurs to that of the blood vessel as well as the blood cell. As everybody get familiar with what do you mean by isotonicity, hypotonicity as well as hypertonicity. So hypertonic solution, it may be administered efficiently in LVP. Small volume of this hypertonic solution, it will be administered in peripheral vein. But whenever we have to inject the large quantity of hypertonic solution, it can be inserted directly into the large central vein, that is nothing but subclavian vein, or which is also called as the internal jugular vein. This is just because of the high blood content, it will be directly dilutes this LVP when we inject in a large quantity. Now the next, the reflection spot. Now in this reflection spot, here just think student, what are the various types of the large volume parenteral and what are the various specialized LVPs. So in next we will see what are the various types of LVP and the various specialized LVPs. So let us discuss the first one, that is the types of LVP. So the types of LVP, it includes the electrolyte solution, carbohydrate solution, nutritional solution, fat emulsion, total parenteral nutrition, intravenous admixture as well as the peritoneal dialysis fluid. So let us discuss the first one, that is the electrolyte solution. So electrolyte solution, this is administered during the diarrhea and the vomiting, and this diarrhea and the vomiting can be corrected by administering this electrolyte solution. So this electrolyte solution, it can maintain the balance between the extracellular fluid as well as the electrolyte loss. So very first example is the sodium chloride. So sodium chloride 0.9% weight by volume we can administer, and the osmolarity, that is in the range of 308 milliosmol per liter we are getting. And here in this case, if we consider the antioxidant, it is not necessary to add, and the buffering capacity, it is also low, and the pH we have to maintain as a 6. Now the next, let us discuss about multiple electrolyte injection. So this multiple electrolyte injection, it generally consists as that is similar to that of your normal plasma, and it shows the pH nearer to that of the extracellular fluid, and many times the potassium deficiency, it may be get developed due to the stress, and this will be get nullified by addition of potassium chloride. So in this formulation, in this multiple electrolyte injection, the formulation most probably sodium chloride, sodium acetate, then sodium gluconate, and as well as the potassium chloride, magnesium chloride, hexahydrate, and last one is water for injection. So here this gluconate, it will be acts as a precursor to bicarbonate ion, and the acetate, this will be rapidly metabolized to provide the alkalizing effect. In this case, the pH is maintained as 7.3, osmolarity is 294 milliosmol per liter, whereas not necessary to add the antioxidant, and buffering capacity is again low. Next one is what here, that is the multiple electrolyte injection. Now this multiple electrolyte injection, again it will be remain as a same whatever we have discussed in, that is multiple electrolyte injection with 5% weight by volume dextrose. Only difference is what here, in that you have to add, that is the in second case we have to add 5% weight by volume of the dextrose. So the difference is what here, when we adding the 5% weight by volume of dextrose, the osmolarity is maintained as 552 milliosmol per liter, and we have to add the addition of the antioxidant, whereas in case of what multiple electrolyte injection, it is not necessary to add the antioxidant. Next one is what, the lactated ringer's injection. So lactated ringer's injection, it consists of what, the sodium chloride, potassium chloride, calcium chloride, sodium lactate, and the water for injection. In this case, the lactate ion is metabolized in liver to glycogen, and which releases the carbon dioxide and water, and it gives the alkalizing effect. Whereas the pH is maintained as 6.5, and the osmolarity is 273 milliosmol per liter, and not necessary to add the antioxidant, but in this case the buffering capacity is high. Next one is what, that is lactated ringer's injection with the 5% weight by volume of dextrose. So composition is similar to that of the lactated ringer's injection, only the addition of 5% of the dextrose, where the pH is maintained as 5.1 and the osmolarity is 524 milliosmol per liter, and not necessary to add the antioxidant, and buffering capacity is again high. So this is all about the electrolyte solution. Next we will see the carbohydrate solution. So this carbohydrate solution, it provides the source of water for hydration and carbohydrate calories, and the various example, that is 5% the dextrose injection. So this 5% dextrose injection, where the dextrose metabolizes rapidly and the water moves into other body compartment. So if it is an emergency situation to replace the large losses of body water, the injection, it can be administered at a rate of 8 to 10 ml per minute, and this solution maintains the pH as 4.8, then osmolarity 252 milliosmol per liter, and no addition of antioxidant, whereas the buffering capacity is again low. Next to that here, the 10% of the dextrose 10% of the fructose injection. So again it consists of what here? The fructose. This fructose shows the better glycogen former than the dextrose, better metabolism than the glucose under the stress condition. So pH 3.8 then osmolarity 555, calories you will get as a 400 and no need to addition of the antioxidant. Next one is the 10% of the invert sugar. So this invert sugar is consist of what? Equal mixture of dextrose as well as the fructose. pH is maintained as 3.9, osmolarity is 555 and calories again you will get as a 400. Next to that here, the nutritional solution. So nutritional solution again it consists of what? Amino acid injection, then amino acid with electrolyte, then amino acid with, that is the 25% of dextrose and the electrolyte. So again we have to take care of what here? The pH and the osmolarity, whereas the antioxidant it is necessary to add, and what about the buffering capacity. Next to that here, the fat emulsion. So this fat emulsion again it will be the type of LVP and it consists of soybean oil, then egg yolk, phospholipid, then glycerine and then water for injection. Now the next to that here, that is total parenteral nutrition. It consists of, that is the protein, energy, electrolyte as well as what? The trace element. And this total parenteral nutrition it can be either used in hospital or either it will be also used in the home. This is called as what here? Home parenteral nutrition. So again in this case you have to use the subclavian vein for the administration. Next to that here, that is the specialized large volume parenteral. So specialized large volume parenterals it includes what? The hyperelementation solution, Cardioplasia solution, then peritoneal solution and then irrigation solution. So this hyperelementation solution, very first we will see, it consists of what? That is the mixture of dextrose, amino acid, then the lipids. Lipids can use soybean oil, safflower oil or the mixture of two. And again it consists of what? Electrolyte as well as the trace elements and the vitamin it can be added. So this hyperelementation solution it provides the 4000 kilocalorie per day. And again here in 1950 the subclavian vein it considered as an effective way for the parent nutritional. Then the next one is what here? The Cardioplasia solution. So this Cardioplasia solution, this is most probably used or it will be considered in the heart surgery to prevent the ischemic injury to the myocardium, that is during the time the blood supply to the heart it is to be clamped off. And it consists of what? The calcium chloride, dehydrate, magnesium chloride, hexahydrate, water for injection, sodium chloride as well as the potassium chloride. Next to that here, the peritoneal dialysis solution. So peritoneal dialysis solution it contains glucose, then again salt, mineral and the water. So the person, that is if any type of surgery if it is to be going on, in that case here this dialysis solution it will be again used for the perfusion or for the dialysis purposes or infused continuously into the abdominal cavity, and the toxic substance it can be get removed. Then the next one is what here? The intravenous admixture. So intravenous admixture it is nothing but here one or more sterile drug product this is added to an IV fluid. So generally the additive SVP it will be added to the large volume parenteral and this is to be added for the continuous infusion, and while using this intravenous admixture we have to take care that here the HEPA filter laminar airflow it should be totally get utilized and all the care of the personnel it should be taken into the consideration. Then the next one is what here? The irrigation solution. So irrigation solution it is not generally used for the administration, but this is to be used for the irrigation, flushing as well as the cleansing of body cavities as well as the wound. And this includes what here? That is various types of acetic acid irrigation, neomycin and polymyxin B, reverse irrigation, sodium chloride as well as the sterile water for injection. So again it is mandatory it should be the sterile as well as what here? The totally free from pyrogen. So student, this is all about what here? The LVP And what are the various types of LVPs?